Hi everyone, I'm going to share to you about autism spectrum disorder, or most commonly known as autism. So autism came from the Greek word for self, auto, because researchers observed these children as withdrawn in their own closed-off world. So autism is a developmental disability that affects social interaction, both verbal and nonverbal communication. So it is a slow incident, but the rate of individuals has dramatically increased in the past decades. So it is 5 times more likely to happen in boys than in girls. All ethnicities and socioeconomic groups are diagnosed with it. So despite the stigma, only 38% of children with this disorder have an intellectual disability. So now let's talk about their characteristics. So when it comes to communication, social interaction, 1/3 of children with autism are nonverbal. So with that, they have language difficulty, and they usually are delayed in word or speech development. So this individuals usually have lack of interest in others. They are content to be by themselves, and in some cases, individuals are outspoken and come off as rude. They usually violate others' bubbles or others' personal space, and they have difficulty in maintaining eye contact. So when it comes to their behavior, they are very sensitive to stimulation, sensory experiences such as loud noises. So they don't like loud noises usually, and they have emotional regulations. They usually outburst, scream, throw tantrums, and often it's because of overstimulation or disrupting routine. So they have repetitive pattern of behaviors or activities such as racking, clapping hands, and they are unable to handle changes in routines. So they are highly focused on their interests, or they have obsession problem. So they're picky eating normally from textural issues, and they have irrational fears and sleep disorders as well. So inside the classroom, there are certain challenges. Okay, so when it comes to communication, there is a lack of interaction with students or teachers. So they don't have interest in peers, as mentioned earlier. So others normally want to make friends or to interact with others, but due to some communication difficulties, they are not able to do that. So it's very limited. So when changing activities, it's very hard for them to redirect their attention. So they, when they are going to, when they need to redirect attention, they usually throw tantrums if told to do so. If told to do something else, or they will not respond to instruction well. Okay, and then for the age appropriation, they are not usually interested, or they don't usually interact with activities children of his age are invested in. And for the comprehension, many individuals with ASD are brilliant in several specific areas such as reading and comprehension, but some are still struggling with it. So now let's proceed with the medical advancement. So this disability is relatively new to the world of medical research. So the first focused research that began to explore behaviors of autism occurred in the year 1940s. So there's no cure, only treatments, but these treatments vary from person to person. So there is therapy available along with medications to help decrease some symptoms. So There are two major contributors to the knowledge that we have in regarding autism. The first one is Leo Kanner, and the second one is Hans Asperger. So Leo Kanner has his popular viewpoint of form of childhood psychosis, or in other words, it's caused by bad parenting and refrigerator mothers. So this view has been very popular for a very long time. So Hans Asperger's contribution is he developed the ideas of spectrum. He also thought that this was not a rare condition, and we now commonly accept this ASD as a spectrum disorder. So of course, whenever someone has disability, he needs people to support him. So family is the most important support these individuals have, because they usually because they are staying with their family for almost every time, and his family knows their strengths and needs, culture, and a visible support unique to this individual. So according to the principles in the EA law, a team needs a parent, a general education teacher, special education provider, a representative of the school district, and an educational professional who can interpret assessment results. So this team is called a multidisciplinary team. Other professionals that can also work with individuals with ASD are the occupational therapists, speech therapists, nutritional therapists. So for the ages 0 to 3, there's a program which is the individualized family service plan, and for the 3 or older, they have the individualized education program. So this should be carefully designed based off of modern, well-researched interventions. So the organizations that are supporting ASD are Asperger Autism Network, and then we have Association of University Centers on Disabilities, Autism Now, and lastly the Autism Speaks. So actually there are many technology or resources or technology that this support team can use in order to help our ASD patients. So first we have the developmental individual difference relationship, or the DIR, relationship-based model, right? Okay, and this one is very helpful to social function, emotional function, and information gathering, so that it will increase their capability on these areas. So this program is for ages 2 to 5 years old. So we have the discrete trial training. This program increases the cognitive skills, language, adaptive, and compliance skill. This program is for ages 2 to 6 years. So third, we have the Lovaas method. This increases the adaptive skills, the cognitive, language, and compliance skills, the IQ, and also the social functioning of patients. So this program is for ages 2 to 12 years. The next one is the picture exchange communication system. So this increases the speech and language development, social communication behavior. This one is for ages 2 and above. So lastly, we have the social stories. The social stories increases the pro-social behaviors of individuals. So it's for ages 2 to 12 years old. So the work cited, we have here the Eagleton, low incidence and high incidence disabilities. We have the film media group Autism Now, rewriting the history of autism of Elon Green, and then we have the Personnel of Peabody College Autism Spectrum Disorder. We have Ryan Chibiuk, CM Katsiani, their research-based educational practice et al. And their research-based educational practices for students with autism spectrum disorder. So, and then Autism Speaks at www.autismspeaks.org. So that's it. Thank you very much for listening, and I hope you learned something from this presentation.